The UK has surpassed 100,000 people who've perished from the virus. It is still a seemingly inexorable rise. And on last night's Newsnight, we heard that there could be between 40 and 50,000 more deaths. Today, perhaps jolted by the impact on the country of yesterday's milestone, the Prime Minister announced that he would soon set out the roadmap long demanded by Tory MPs for a gradual and phased relaxation of COVID restrictions. First would come schools. His target for reopening in England is the 8th of March. Understandably, Boris Johnson might rather we lift our eyes to the future, but day and daily there are still issues with test, track and trace, problems with people not self-isolating, debates over vaccination for workers on the NHS front line, and a resurgence of the virus in care homes. And that's where we begin tonight with this report from our policy editor, Lewis Goodall.
The COVID crisis began for everyone, somewhere, at some moment or other. A moment where each of us realised how serious this was, like a pall descending. For this programme, one of those moments was here, last March, in Hove, on the south coast. There's been so many themes to this crisis, whether it's schools or hospital capacity or lockdown, when to reopen, when to close, PPE, the economy, that it's been easy to be dumbstruck by it all, to lose sight of what really has mattered. But throughout there has been the crisis in care homes and in care more generally. So many of our 100,000 deaths have taken place in these supposed places of care, sanctuary and safety. And it looks like the data is heading in the wrong direction once again. There are still gaps in the so-called protective ring. That is, if it were ever truly there in the first place. The number of care home COVID deaths were extremely high in the months of spring. They rapidly declined as lockdown kicked in and remained at lower levels for much of the summer, autumn and even into mid to late December. But in recent weeks, they have started to rise rapidly again. Last week, there were 3,615 COVID care home deaths in England and Wales alone, up 32% on the week before, up 157% on a month ago. In March 2020, we came here to the Grange Rest Home. Sandra, its manager, told us how concerned she was for staff, how little guidance there was, how they didn't even have enough PPE, how they weren't ready. 10 months on, in a few respects at least, it feels as bad, if not worse.
I find this time round actually harder. I think it's had a real impact on their mental well-being, and I've got at least 4 people here that their mental well-being is to such an extent we've had to refer them to mental health services.
And how does that manifest? What does that look like?
It can be through like physical symptoms. They can become, not eat, lose weight, sleep pattern, trouble focusing, concentrating, really low mood, very tearful. One particular lady going out 3 times a week. Now she spends huge periods of time in her room. I spent an hour with her yesterday trying to talk her down from feeling really, really desperate.
Must be very hard.
Yeah, it is.
Vaccines have come. Every resident and staff member here has received their first dose. It's been a success. But for many, it doesn't detract from all that's come before.
We truly did everything we could to minimise loss of life.
The Prime Minister said that the government did all it could to prevent those deaths. Do you think that's right from a care setting point of view?
I don't think he did from the beginning. I don't think that the information and guidance was cascaded when it should have been earlier when it first started. I think they were late in giving out guidance and support with local authorities.
And PPE?
And PPE, yeah.
So do you think that had different decisions been made at the beginning, fewer old people in care homes would have died?
100%, yeah.
The scary thing is, at this point, that there isn't much more which can be done. Care homes suffer when prevalence of the disease is so high, when even the strongest measures to protect the home cannot avoid the virus's import. That is what appears to have happened in these last weeks once more. A terrible and lethal side effect of the virus once more getting out of control.
She was so close, and I hoped that she'd just get through and reach the vaccination and maybe she'd be free again so that, I could just see her and take her out maybe.
Amanda's mum is one of those victims. She died in a care home only days ago.
They let me into her room because it was end of life. When I saw her in that bed, the image of her so small I shall never forget. She'd just given up. It's heartbreaking. I watch the news every night and I see the numbers, but just watching that figure and knowing that my mum was one of them, it feels really painful. And you know that every single one of those figures is somebody's mother, daughter, relation. It really does break your heart.
You barely got to see her, really, or certainly not have any kind of physical contact.
I can't really believe that she's not there because I was so disconnected from her life for the last 10 months. I feel like she's still at the home and I feel like I can still ring her, but then I remember that she's not there anymore, and it breaks me, it really does. I miss her.
Lewis Goodall reporting there.